Very low rental.
Oh yeah.
And
I was planning this big party for Saturday. And it's so late, it's 6 p.m. Monday night. And I've got this very good friend of mine that we, and we haven't watched one game together. This is so nice to watch exciting topic. And I can say, oh, you lie in bed and watch. By 11 o'clock.
Yeah.
You know, and he lives in China.
Yeah.
Let's keep going.
Enjoy it. So, I think they're going to do this.
Yeah. It's a tough one. We've had a tough one. And that's not even enough for what I think from Reddit. So, yeah.
So that too, you know, making changes.
No, it's Gives it back to you. Yeah. We announced that we're giving like 5 minutes.
Are we sure going to stick to 5 minutes? Should we start?
There's 3. So it's recorded, and usually people view after.
So people, okay, just to stick to the time, so let's get started. Good afternoon, members of the School of Public Health and others from the other departments. Welcome to today's seminar. And today's speaker is a recent PhD graduate, Dr. Elizabeth, who has just graduated from the University of Stellenbosch, and a very passionate young and upcoming scientist whose interest is in vaccine implementation science. Is that correct?
Very correct.
And Elizabeth has just joined BACPA 2 months now, and very happy already, very happy with you.
Forever.
Excellent work. So Elizabeth is going to speak to us about a new project that is likely to start sometimes next year. And Elizabeth, welcome, and over to you. So you've got 40 minutes to speak about your study, and the rest of the time is spent asking questions. And for those online, you can type your question on chat or just unmute and ask questions later at the end. Thank you so much, and over to you, Elizabeth.
Thank you. Thank you very for that kind introduction. And like Ben said, my name is Elizabeth, and I'm going to be presenting the TEENVAX project, latching on to the recently completed theme of the research week, which is sowing the seeds of research. And I must say right from the get-go that this project is still very much in its infancy. We are actually at the seed stage. We've just broken ground, put in the first application. So please keep fingers and toes crossed that we get the funding. And when we get the funding, I'll be serving as the project lead. presentation is going to be in 4 parts. I'll do some basic introductions, give an overview, a broad overview of the project. Then I'll hone in on the first part and then give you more reasons why you should keep those fingers and toes crossed that we get the funding. So we are back farm, and I would like to use this opportunity to thank everybody that made it to our office during the recently completed research week. We really appreciate your presence. Our vision is Africa free of vaccine preventable diseases, and translating research into policy is again our well-known flagship, the annual African Vaccinology course is set to set sail again early next month, and you are all invited aboard. I also want to use this opportunity to acknowledge all my colleagues in the House, and if you are not from BACFA, please, you could latch on to any one of us, and we'll be willing to talk to you more about what we do and explore avenues for collaboration. So this is the big happy family, of which some faces are very familiar and others you get to know in due. So what really is TEENVAX? TEENVAX is an acronym for tuberculosis, enhancing the espousal of vaccination among adolescents. Now we know that the adolescent population is a very peculiar population, and if you want to do anything, especially vaccination amongst them, you need to get their buy-in, and that's really what the starting point of the TEENVAX project is. So the N and the X is just to make the acronym pronounceable so that we don't go TEENVA. So in the call, 8 institutions are participating, of which Amsterdam Institute for Global Health and Development in the Netherlands is the coordinating institution. In the London School of Hygiene, KNCB, the Netherlands, and several others on the African continent, including the University of Cape Town. And for us here at UCT, 2 departments are participating. There is the BACFA from the School of Public Health and the South African Tuberculosis Vaccine Initiative from the School of Pathology. And these are the PIs from the 2 departments. By way of background, just a couple of things. Tuberculosis is one of the oldest known human diseases. It's been documented even to be found in Egyptian mummies. That there is evidence that as far back as then, tuberculosis was a scourge. And the stats are just depressing globally, regionally, and especially in South Africa. I mean, it's a devastation on the human race. And another sinister thing about TB that may not be that obvious is that it's a major contributor to antimicrobial resistance. And that is a simmering pandemic that, if not managed, could become something of COVID proportion. So seeing this terrible devastation that tuberculosis causes, it is imperative that in a population with, let me just mention briefly before I leave this stats, that in a population with a high TB burden, the economic implications are very, very much heavy. And they include the direct monetary cost of testing, diagnosis, the indirect cost of productivity loss when the patient is sick or even premature death. And the more painful and more difficult to quantify the associated psychological and social costs. TB is a much stigmatized disease. And as old as TB is, currently the only vaccine available to mitigate its scourge is the Bacillus thuringiensis, popularly known as BCG, the vaccine which is over 100 years old. Now, BCG we all know as is effective in preventing TB in newborn and children, but its efficacy beyond childhood has been debatably limited. So, but as developments, scientific developments, processes go on, revaccination with BCG has been, it's been suggested that revaccination with BCG could be beneficial in adolescent population especially, and it should be further investigated, which is one of the things that TEENVAX aims to do. Also, vaccinating adults and adolescents, even with a modestly protective new TB vaccine, in a context or in a population with high burden of TB, has been said to be cost-saving. It's been modeled, it's been shown by modeling studies that it will be cost-effective and cost-saving. So the good news is that quite a number of new TB vaccines are in the pipeline, some already showing promising results. But the bottom line is whether we are revaccinating the good old BCG or we are introducing new TB into the market, especially for adolescents, it is imperative that optimal delivery strategies that will enhance the uptake of both of any TB vaccines be developed ahead of the introduction of that. And I'll speak to that later. So talking of new TB vaccines in the pipeline, I just want to draw attention to two of these TB vaccines in the pipeline. Excuse me, I don't have a pointer, so I'll just have to use my fingers. So I'd like to point your attention to the M72. That's the second to the last block, and then the BPM 1002 for two main reasons. These two vaccines, the first reason is that our partners, SAPVI, are involved in clinical trials of these two vaccines, and then both of them speaks to the adolescent population, which the WHO had identified as a target population for vaccination if we are to meet the target of stop TB by 2035, and I'll speak to that a little bit later. And I'm happy to also say and announce that the South African EPI schedule that will be implemented as from next year, it's also thinking in lines of the life course vaccination. You can see from HPV and adolescent vaccination is going to take a more, shall I say, prominent place in routine vaccination as from. So I'm moving to the second part of my presentation now, the overview of the project. First, I'd like to start with the rationale. The WHO had identified, or they have proposed that for the NTB target of a 95% reduction in mortality and incidence rate by 2035 as compared to 2015, if that target is to be met, not only in sub-Saharan Africa, but globally, that we need vaccines that are given beyond, we need TB vaccines to be specific, that are given beyond the childhood period. And of course, after childhood is adolescent, and the WHO have identified the adolescent as a key target population because vaccinating them brings a lot of gains I've just highlighted two of those primary, two of the most prominent gains that we stand to gain by vaccinating adolescents, because they are our future, they are the adults of tomorrow. If we are able to knock TB in this population, then we can look forward to beating TB by reducing mortality and morbidity, and also healthy, thriving, economically healthy and thriving population. So to justify my project, now it's well known that anything amongst adolescents, this vaccination is a challenge if you don't get there by me, like I said. So therefore, we need new approaches to maximize the uptake of TB vaccines and other vaccines amongst the adolescent population because of their peculiarity. Then also, we know that, as it has been said, that vaccines don't save life, vaccination actually does. But the best vaccine sitting in the vial, and if it's not received, has no effect. And that's another thing that TEENVAX, the project, is aiming to do, to prime this population, this peculiar population, to espouse, as it were, the practice of vaccination amongst them. So to do this, our ambition is to promote vaccination amongst adolescents by investigating or developing strategies that will make for the uptake and receipt of new TB vaccine, or even good old BCG, if that is what eventually emerges that will be used in sub-Saharan Africa. We also want to use optimal delivery strategies using the revaccination with licensed BCG vaccine as a model, and to do that. To achieve this aim, we are going to be using different disciplines. We are going to be using insights from different disciplines such as public health, social science, and economic. So this very busy slide just summarizes the aim and the objectives of TEENVAX. The aim is to develop and evaluate an evidence-based strategy for the delivery and uptake of novel vaccines against tuberculosis amongst adolescents in sub-Saharan Africa. And to do this, we are going to be using 7 interlinked objectives. I just highlighted in bold the important phrase of all the objectives, so that at a glance you can see what those objectives are talking about. But I'll be honing in on the first 3 objectives presentation. So the study sites and the population, adolescents, again, I can't overemphasize that they are a key target population for reasons I have earlier mentioned. And for this particular project, we'll be looking at ages 12 to 18. At some point or the other in the project, parents, teachers, guardians, healthcare providers, policy stakeholders from the Ministry of Health, Ministry of Education will also be involved in different ways. 3 countries will be participating in the TEENVAX project. One is Senegal, it's a francophone country, Mozambique, it's a Lusophone country, and South Africa, we have considered an Anglophone. Still, on the overview of the project is broadly divided into 3 parts, even though there is overlap between the parts. So the phase 1 is the formative research, which I'll be putting in on. That's the last part. And then the phase 2 is the community randomized trial, where the results of phase 1 will be tried out And that phase 2 will be carried out for South Africa and carried out by SACB. And phase 3, the health and economic impact analysis will be carried out by our international. So this is my capacity, and this is where I'll be focusing my energy. So the formative research that you saw on the other slide is broken down into 3 parts. So you have the qualitative research, in which I aim to conduct a maximum of 60 interviews amongst 5 different groups of stakeholders. The parents, the adolescents themselves, healthcare staff, and policy stakeholders from relevant ministries. And this in-depth interview addresses the first objective. Remember the 7 interlinked objectives, which is to gain essential insight in health systems, into the context of our health systems and societal acceptance, and societal drivers of vaccine uptake by adolescents in general, and then specifically regarding TB vaccination. This will be done, the transcripts analyzed, the report prepared, then we'll move over to part 2, which will be to convene a stakeholders workshop, where the results from the qualitative exercise will be discussed and used to formulate discrete choice attributes that would also inform the next phase of the project. So, this stakeholder workshop will include representatives from the communities and schools, because I'm not only targeting adolescents that are in schools only, also those in the community that are out of school for whatever reason. So it will include their representatives, where the data was collected, and then as well as members of NITA, the National TB Program, pharmacovigilance centers, and relevant ministries. By that I mean ministries of education and ministries of health. And this exercise addresses the second objective, which is to integrate whatever insights that we have, we obtain to develop a set of supportive delivery strategies, SPH, which is actually what will be tried out in the clinical, in the community randomized trial. And then finally, the discrete choice experiment, which also speaks to the second objective, but what it's addressing is to understand the preferences and trade-offs made by adolescents and parents and guardians for the different attributes of new TB vaccines and their delivery strategy. So I just wanted to say the difference between the 1C and the 1A is that here it's for the 1A it's in-depth qualitative interviews, but for 1C, the discrete choice experiment, it's going to be an interviewer administered questionnaire of about 25 multiple choice questions. So, honing in specifically on the qualitative interviews, I'll be using the behavioral and social drivers of vaccination framework proposed by the WHO, and I'll adapt the interview guide for the 60 interviews I mentioned earlier. And the reason for this is because the behavioral and social drivers of vaccination have been identified to define experiences that are specific to vaccination that are potentially modifiable, which is what we want to see see in those communities what we can modify to increase the uptake of TB vaccines when it's ready. And even though they will be modified to suit our context, I will still retain the priority questions and indication so that the results obtained can be generalizable and be retaining its interoperability with the standard best tool. And the focus of the whole exercise is to understand the social and economic, political and religious and vaccine-related considerations such as safety, tolerability. So I'm almost done now. These are just to highlight some strengths and potential impacts of the study. The strength of the study to show you the robustness of the study and the potential impacts to keeping those fingers crossed that we get the funding. So for the strength I've highlighted, in red, the interdisciplinary model that it's employing in public health, economic modeling, and all that, bringing different disciplines together really gives the study strength. And I particularly like the open science side because it shows that the results will be available long after the project is over. And then two main deliverables of this project. The project itself, the entire TEENVAX project, spanned over about 4.8 years. And at the end of it all, we hope to have an implementation toolkit and a policy support package that will be available and also applicable, to not just in sub-Saharan Africa, even though specifically developed here, and that accounts for the different contexts, because think of it globally, countries are either francophone or anglophone, and one good thing that will keep us in the School of Public Health training is the strengthening of research capacity that this project brings, because we are hoping to graduate at least 2 PhD students, one from BACPA, one from SAPI, minimum, and then the community engagement where we bring together the policymakers and the people in the community on which their policies are being administered. So you can see that this really is a good project. So please keep fingers and toes crossed that we do. So these are the references you saw on the earlier slide. And thank you all.
Excellent. Thank you so much, Elizabeth. That was quite nicely done, and with plenty of time to spare for questions. So, any questions from the floor or from the online team? Simply, were we able to see whether there is? Just unmute yourself, those who are online, and you want to ask a question. Just unmute yourself and ask a question. Elizabeth, while we wait for questions to come through, can I ask you one question? So your age range is quite big, so 12 to 18, and some of these teenagers will be in primary and others in high school.
We are primarily targeting high school teenagers. Yeah, what I get to see.
Yeah, do you think the strategy that may be applicable to some in primary school will be different to the ones in high school? And related to that is the issue of consent that is needed, especially what we've learned from HPV, It's one of the reasons, according to the department, most vaccinations were never done for HPV was because parents did not return signed consent. So if we get one voice from the parents saying that they want to be involved and make a decision, another voice from the teenagers themselves saying they want to actually make those decisions themselves. How do we deal with that?
All right. That's the beauty of TEENVAX project, because like I mentioned earlier, we are going to be using the BCG revaccination as a model. Now, most of these adolescents would have been vaccinated with BCG at birth, because that's standard procedure in this part of the world. So I don't foresee a challenge. I don't foresee a big challenge in most mothers recognize BCG, even if they don't go on to take other vaccines because it's given at birth. So in most mothers, most people are being vaccinated. So it will be an easy sell. I foresee an easy sell. But however, if challenges rise up as because of the vaccines, I think it should be limited and we can easily work around that. Now to the issue of consent and assets, because I know that we will have to, I mean, when we are dealing with the big boys, the 18-year-olds and all that, they don't need consent. In fact, they are happy to exercise their adult rights to call the shots. But for the issue of consent, that's where these the revaccination with BCG also comes in again, because parents are more likely to consent to what they know. I mean, I had this lady 14 years, 12 years ago, was vaccinated and she's fine, he's fine. Yeah, they will be more open to give consent. But if we do encounter such issues, then we'll pull out something from our toolkit and we'll apply it.
Okay, excellent. Edina, go ahead.
Elizabeth, thank you so much for that presentation. And when Ben mentioned HPV, I was just thinking to myself, you know, the buy-in from the adolescents for making sure that our HPV vaccination programs are adolescent-centered has been one of the main challenges. So I was just wondering whether you could speak to how this TEENVAX study would contribute to innovating vaccine demand, you know, how we encourage vaccine demand within our adolescent populations. And then secondly, I wanted to know, you said there were 2 other countries that will be participating in this study. So whether the buffer part would also be replicated in those other countries.
Yes. Okay, let me start with your second question. Yes, exactly. Although with the some issues might be amended to suit the specific context, but broadly, all participating countries will follow the same protocol. So generally, it's what will be done in South Africa will be replicated in Senegal and will be replicated in Mozambique. But maybe 1 or 2 things to suit their specific context will be amended. And yeah, I spoke about supportive delivery strategies. When we know that, because that's what TEENVAX is about, to test out maybe 2 or 3 of these strategies in a community randomized trial, we will be able to say, look, this strategy works best for the delivery of TB vaccine or BCG revaccination. HPV may want to look into it and adapt it. Also, one of the things that the TEENVAX will do will be to get the adolescents themselves involved in pharmacovigilance, which to the best of my knowledge, I stand to be corrected, I don't think has been done with any other vaccine. They will get a little diary and a little pen, and then from the day of vaccination, if they experience any adverse effect, they will record, and so they feel, involved. You get their buy-in, and whatever else that they would like for the researchers to know, they will document it, and then at certain points, day of vaccination, 7 days, whatever, but that is actually part of the community randomized trials. So I really can't speak much about that, but I can tell you that with those two things, the supportive delivery strategies tested out and then the best strategy identified, and also getting the adolescents involved in pharmacovigilance by them documenting their own experiences. I think other vaccines like HPV and whatever else is recommended for adolescents can then stand to gain from that. Yes.
So do you, because I see Elizabeth, so thank you for your presentation. It looks like a very interesting, and I pray that you will get the funding for your project.
Thank you.
But do you expect that the parents will know, like we know about TB and we know about BCG, do you expect that they will have knowledge about TB and BCG vaccine?
I suppose for the most part, the knowledge may not be much, but I believe that especially mothers, they know that there are some vaccines that are administered before you take your baby out. They may not know what it is, what it does, but they have a general idea. Most mothers do.
Be surprised when you do the interviews.
All right, I'll prepare for that.
They feel compelled to have the baby vaccinated. Because they
No,
just
they will say vaccinated, but you will surprise that you will know none of these TB, pertussis, no, they will say that no, I don't know them, just they got the vaccine.
Yeah, exactly. And that's good knowledge. So I can start from that, from what they know, that, oh, you remember that vaccine that, the nurses just came and jabbed? Exactly.
All right. Any other question to Elizabeth from online team? Kate, you know this project very well. Do you have a question or a comment? Kate? Kate, you unmuted, but still we can't hear you. I wonder whether it's on our side or your side. Sorry, I see.
Sorry, I am very poorly on the trust, but nothing to add.
Okay.
Just a general question to you, Elizabeth. Do you think that it would be easier to give adolescents BCG or TB vaccine than HPV? Do you think the challenges differ?
I believe they are.
What do you think the main challenges are?
For one, HPV is a relatively new vaccine, and you know that people generally, adolescents or adults, are a little bit cautious about anything new. And for BCG, I mean, it's over 100 years old. Their mothers had it, their grandmothers probably had it, and so the time of vaccine.
But let's assume it's VPN. So it's another. Okay. It's not BCG. It's another TB vaccine.
Or messenger RNA TB vaccine, which is being developed.
You and I, as scientists, know BCG RNA vaccine, but the population out there just knows BCG. So it's how we sell it to them, it's how we present it to them. The advantage that that a novel TB vaccine will have over any other vaccine is that it will be riding on the back of BCG. which has been known to be effective, mild injection site irritation, not serious side effects like other vaccines had shown. So, the ability, safety, and effectiveness of BCG in childhood really is a strong selling point for a novel TB vaccine over any other. But having said that, we can learn from TB vaccine, and that's the more reason why this project should be funded. Sorry, I keep saying that. Yeah, I wish the funders were in the room. But yeah, because it will not only serve as a model for the best way to go about TB vaccination or BCG vaccination, but it has the potential of supplying data that could be applied to other vaccines. Yes.
A related question to what Gregor said, has asked, in terms of risk perception, which is one of your ESD2, best two. Do you think the perception of risk of TB, from infection all the way to the clinical disease, do you see some similarities with the way people may see the risk of HPV acquisition, given that both diseases, if you look at the disease history, it's not like flu or COVID, which you get and the next week you're sick. So this is when infection with mycobacterial tuberculosis can take ages or forever without necessarily causing disease. The same with HPV. So do you see some similarities in terms of risk perception from the communities that you deal with?
To be honest, I've not really thought along those lines, but there is a possibility because TB is a highly stigmatized disease, and in that way, it kind of bears a similarity to HPV because I don't know, I stand to be corrected, but I would probably have come across the fact that HPV, the spurious relationship between HPV vaccine and promiscuity and that kind of a thing. So yeah, the risk perception for TB from anecdotal evidence is high generally in South Africa because somebody knows somebody who knows somebody who has had it because of the high incidence and prevalence rate. But for HPV, like you said, I wouldn't call it. Such the disease caused by human papillomavirus is more similar as a lifestyle disease than as a vaccine preventable disease, and that's one of the paradigms we need to change.
Okay, excellent. So I see, so Kate, you can read your chat. I see there is no other question online or from the in-person team. I think we had Elizabeth just to say thank you very much. Excellent presentation. And we're crossing everything that you get from it. You said even toes.
Yes.
So we're doing that, and hopefully next time we're going to be standing here talking about the study. It will be what you're doing.
Yes.
Because you'll have received the funding. Okay, thank you so much. The meeting because it's being recorded now. You get it? Yeah.